So just as a very quick reminder, what of COMFORTage mission, it's a very ambitious project because basically it tried to focus on all, I would say, the different aspects of prevention, but prevention taken as largely. So it's not only primary, but it's also when people are affected, what can we do to try to reduce the burden or reduce the progression of the disease when we can. So it's also secondary, tertiary, and even quaternary, because we try to also to address problems in the health system by detecting what is not working. So it's also dealing with monitoring and those interventions for people. So we are focusing on delivery services for a disease which has a major impact on people and on health systems. But actually, many policymakers, and we have a webinar in September on this, are a bit at a loss on what can be done because it's seen as a disease for which there are not so many possibilities of intervention, especially Alzheimer, of course, but that's not only about Alzheimer. Neurological diseases are much wider. And so most of the efforts today are targeted at extending the period of autonomy and to some extent improving the quality of life. So that's what people have been focusing upon, with or without, up to now, the use of digital technologies. But we know that actually this disease has a major impact on all aspects of life, and not only on the patient, but also on the families and the carers. And we also know that basically many of the solutions, and we know that the new technologies which are coming up, especially with the arrival of artificial intelligence, are becoming much more, much wider in scope, but are not always as usual and customizable as they could be, considering the local needs and the diversity of situations. And finally, also, we know that the link between the clinical and social domain are also important. So what we try to do with this community is to bring you into a journey. As you see, we already had the first one, we had the second one, and we'll go on this journey, building on each, trying to build on the learnings from each webinar. So we want today just to focus on intervention. So what can be done with the support of digital technologies today for people affected by frailty? And so we want to see what is basically the objective here, because it's a wide scope. It's also trying, for example, to assess who is affected by cognitive decline. For example, there are many tools which are today tested related to assessing. There are also, as you can see, a lot of simple tools, which even those tools are not today not necessarily widely used by people affected, like a simple alarm clock. Sometimes just to remember, to help as a reminder, is sometimes not even available. But the one that you see there are the ones that people have usually in mind when they speak with people with dementia frailty. But it's obviously goes much. It goes beyond that. It goes to monitoring, so the use of sensors, the use of technologies which can basically stimulate, which should have an impact on cognitive simulation, like virtual games, serious games, and so on and so forth, virtual reality, and up to very complex technology like the one you see in the bottom of the screen, the use of social robots, which can be used as companions for people in daily life activity and communicate with them. So, and which are not so reluctant to repeat the same thing over and over again if it's needed. So it is also clear that those interventions need to be targeted to the users. It's linked not only to the disease, but also to the stage of the disease. And it's also it needs to take into consideration, as I said, not only the patient itself, but its environment and the people who are living with those people affected. It's also important that we have in mind that some of those tools are more trying to focus on coordination between healthcare providers, social professionals, and the family and the patient itself. Some are more directly targeted to individual people, I would say. And the level of maturity is also very important, as we have a lot of tools which do not make it to the markets, or are just too costly, I would say. So in terms of affordability, they don't reach their target just because there is nobody to pay for it. So it's a question of legal and regulatory compliance, but also of trying the right angle. And sometimes it's needed to simplify, to make it affordable and accessible. And thus, finally, they rely on different types of technology. We'll see some of them in the different presentations, but there is today a wide range of technologies which is at stake. So to speak about this, we'll have three speakers. Sergi Valero to speak with, which is Deputy Director of Research at ACE in Barcelona, so the Alzheimer's Center. And we'll first of all start with an important perspective, because he's really working with people affected since many years, so that the center is existing since already quite a long time, and they already have quite an experience in trying to see what can be useful, what is deployable, and what kind of things they think could be better used in the future. So we'll start with them, and then we have two market presentation. One from Aristodemos, who is working as R&D Director at Innovation Sprint, and was also part of the consortium project, which will try to see which kind of user interface, basically, and could be used as an integrator for different technologies or different solutions which can support the patient and his family. And family, I've invited Marco Pierini, which is not in the COMFORTage project, but which has developed a number of products which made their way to the market. So we want first to have, with those three presentations, to have a first glimpse on what's working, what is seen as really important by organizations dealing with patients, and then we'll have four important partners in the project, which will bring specific insights on specific aspects, and we'll discuss with you all the key challenges between the use of behind the use of digital technologies. So let's not waste more time. I will then leave it to Sergi. Sergi is with us, and you can see the screen. Sergi, now the floor is yours.
Good morning to everybody. The target of this of my presentation is just to have a look of all the activities and the projects that we have ongoing, considering or inserting some digital tools in our day-by-day activity. So this is just a shot of the points that I want to show you. First, quickly, something about us, my institution. Later, we talk about the ongoing projects, and then the projects that we want to explore, to run in the next future. And finally, we show some key messages connected, obviously, with our experience of this kind of activities. Let's see something about us very, very quickly. Alzheimer's Center is a non-profit institution. We have more than 30 years of experience in the frame of Alzheimer's disease. We include more than 100 professionals. We talk about neurologists, geriatricians, psychiatrists, neuropsychologists, social workers, etc., etc. We see every year more than 3,000 new patients, and we have the follow-up of 6,000-7,000 patients. We have an integrated clinical care and research units focus on diagnosis, rehabilitation, genomics, proteomics, imaging studies, etc., etc. Our model, it's a person and family center with a vision to make Alzheimer's history through science and accessible innovation. Let's go to the main topic of the presentation, the projects that we have ongoing. The first step is to know that we have an extensive experience focused on biomarkers, genetics, proteomics, and imaging, as I mentioned before. But during the last years, we have been very focused on the analysis of some digital biomarkers. And among these biomarkers, the analysis of spontaneous speech is a hotline, for instance, the most important project. And it's a very interesting framework because the language offers us the possibility of an early detection of subtle language changes. It's in the classical research of dementia, memory and executive functions are the cardinal functions that we explore. But we know that if we explore systematically language using computational procedures, we have the opportunity to detect some very early conditions of the patient that are even appear before the appearance of the first symptoms of the condition. Yeah, the possibility to analyze speech in a computing way allows us a non-invasive monitoring and cognitive decline over time, a remote applicability of health telehealth settings, and a better diagnosis and accuracy when combined with other biomarkers. And everything obviously conducted under an AI-driven context. So we have started working with a tech team that created Punto. Punto is a small technological company. And we are working together. We are working to create a simple and reliable digital tool to track cognitive health. The platform offers an easy-to-use tool for both professionals and families, and it helps improve care and supports independent living. Our role is to make sure that the technology is grounded in a real clinical needs and everyday challenges of dementia care. The platform has two parts: the Punto Clinic, that is focused on clinical assessment and continuous cognitive monitoring, and the Punto Care, that offers tools for daily support, cognitive stimulation, and practical resources for patients and their families. What we have done in our clinic, in our memory unit, is to apply the Punto platform as a standard measure, as a standard element inserted in our protocol of assessment, using a simple task of speech with this digital tool. Allows us to carry out part of the evaluation, sometimes remotely at home for these patients, but sometimes also in the context of their face-to-face activity. The main idea here is the proper feature is to identify cognitive issues early and track patients' status at home. We have at the moment, using this platform Punto, more than 5 individuals analyzed. We have been able to validate the Punto platform as an effective tool in our clinical workflows. The data supports its value as a robust strategy for distinguishing between clinical phenotypes, people with or without cognitive impairment, and also being a simple, consistent way to estimate patients' cognitive abilities, because we have good correlations between the parameters that we obtain in the analysis of spontaneous speech with our standard neurocognitive batteries. Looking for people with cognitive impairment, a traditional healthcare system usually waits until people shows clear symptoms and asks for help before taking action. Because of this, many people experience long period of cognitive decline without being diagnosed. This is a situation that occurs very common. And we know that by the time symptoms are noticed, the disease may progress too far, and it becomes harder to treat or slow it down. At ASE, we believe that we have opportunities to implement some strategies in a proactive way, allowing us to act early and more effectively in the care system. And what we know is, the question that we have now is, what about if we look for people with cognitive difficulties, but not in my office? What we are doing just now is to went out of our office and to visit the city, our city, Barcelona, and to look for places that are easy to find in any European city, that they have a strong local presence. And I'm not talking about the church, but I'm talking about the pharmacies. The pharmacy is an institution that it's easy to access, on family basis, especially for all the others. Well, our idea is that by adding simple cognitive checks during pharmacy visits, we can detect early memory problems and reach people who have no idea about their cognitive status. And how we do this? Well, we have an agreement with 10 pharmacies very close to our institution, to our memory unit in the district of Les Corts. Les Corts is it's a very central district in the city of Barcelona. We have the agreement with these pharmacies, and they want to collaborate with us in this new project. The specific procedure, well, the screening involves a brief language task recorded directly in the pharmacy using Punto platform. The audio recordings are processed automatically, generating a risk score through artificial intelligence in just few minutes. However, we don't deliver results on the spot, because it's a bit complicated for the patient to receive this information in this context, okay? And we wait for a few days to do this. In the case of a negative screening, we inform the user via email. And in the case of a positive screening, we follow the case by telephone. In these cases, with a positive result, what we do is to offer them an appointment in our institution, in our open house initiative, that it's a problem where the person receives a full neuropsychological evaluation to confirm or rule out the initial screening results. At the moment, we have explored more than 400 users in pharmacies, with a ratio of around 40% of positive cases. And we are not just now sending emails for negative results and call the positive cases to invite them to be part of our setting. Next topic, project that we have project for the next future. Okay, what about menopause? Many women say that they experience problems like brain fog, forgetfulness, or trouble focusing during perimenopause and menopause. Even though these issues are really common, people often think that it's just stress or getting older, and they don't consider that it may be something related to how the brain is working. So we want to identify women who have been experiencing cognitive problems, that they go beyond that experience during menopause, not assuming this in a simple way, that they assuming that there's difficulties of normal or minor. As you can see in the last sentence of this table, menopause cognitive symptoms may mimic early MCI symptoms, but are usually often reversible or fluctuable with time, but not always these symptoms are consequent of the menopause condition. In any case, it needs a specific assessment, okay? For this reason, and following the same protocol that I explained earlier, in pharmacies, what we propose is the implementation of a model proposing a comparable one that I was showing in the previous one. We want to establish an alliance with the Sheus. The Sheus is a very well-known clinic here in Barcelona focused on women's health. And the idea is to offer, again, a both-based cognitive screening using Punto platform to women in the menopause transition. Yeah? And when the result indicates an elevated risk of cancer, the participant is then referred to our memory unit for a full diagnosis assessment. The model combines the specific clinical expertise of the cells with our own experience in neuropsychological and neurological assessment. And our intention, our plan is to start this project after summer holidays.
Sorry to interrupt. Sergio, you have a couple of minutes more.
Okay.
Thanks.
We are involved also in what about taking care of our patients? We want to use also the Punto platform, but in this case, what we want to approach is the possibility to take care of our patients, providing them information, resources, platforms, exercises, ideas to manage their condition. We are touching things at the daily routines, nutrition, hydration, physical activity, cognition activities, behavior changes, legal considerations, etc., etc., etc. We are very proud to be part of usually also the COMFORTage project. We are collaborating with 3 tech companies, with Elegance, with Linguistic Brains, with Shansentia. And we have also other projects ongoing. Most of them focus again in spontaneous speech assessment, but also in memory, everything encapsulated in digital platforms. And finally, some key ideas of our experience. First, digital platforms enable early detection outside traditional care settings. Remote tools promote early help seeking before symptoms escalate. Our model transitions for individual assessment to scalable populations level screening. We combine clinical validation with the user-centered tech innovation. And our model is ready to scale across systems granted in research. And that's all. 14 minutes. Sorry, Sarah. Thank you very much.
That's fine, Sergi. I think why I wanted Sergi to start with it, because what he's proposing us is not only a proof of concept, it's really an implementation process where he's really trying to find the right angle to use this technology and the right actors to support it. So, Sergi, maybe just I'll give you 30 seconds more, because I really want you just to say, how have you been collaborating with, for example, you mentioned Punto, in order to make this solution really trusted and usable? So how has been the development process? So can you just take a few more seconds to explain us?
Yes, we discovered this small company 2 years ago, no more than 2 years ago, in the context of an academic scientific congress. And Ana Muñoz, that is the CEO of the company, come to me after my presentation, and they offer the idea, because at this moment was the idea of the tool. For me, it was an excellent content, because what I perceived here is that we had the opportunity to co-construct the platform all together. She put all the background in terms of code and in computational capacities, and we put our background based on clinics, scientific and biological background. And the negotiation was very, very easy. And we have a formal agreement between the 2 institutions. That means that with no money, but with a lot of ideas, we are co-designing the same tool, putting our inputs in the platform, and they constructing an optimal tool to be applied in a very real condition as a memory unit, thanks to our experience.
Good morning, everyone. Also, many thanks to Serge for his introduction to their work and the Punto platform. We also have a tool that is similar to Punto. It's called Healthencia, and it's actually a platform for chronic disease patients management. And indeed, as Luke said, it is integrated with other tools in the suite of tools that comprise COMFORTage. So I'm going to talk a little bit about chronic diseases, and aging, of course, it's not a disease, it's a physiological condition, but it is a major driver for chronic diseases and functional decline. And two very important such chronic diseases that we are considering in this workshop are dementia, the various dementia variants, and frailty. There are also other cardiovascular diseases, type 2 diabetes, osteoporosis, certain types of cancers that are related to aging. So chronic diseases actually account for more than 3/4 of the deaths in our population, and 40% of them are premature, and lifestyle is today seen as the main cause of it. In the population globally, we have 50% of people that are living with a chronic disease, and out of them, 40% have 2 or more chronic diseases, and all this incurs lots of medical costs. Almost $50 trillion is the cost of. We will see this cost being up to 2030, and there is a huge care burden. We have 80% of the hospital admissions and 3/4 of all physical visits associated with these chronic diseases. What's the root cause of the problem? It's the lifestyle and the risky behaviors, and these are modifiable. And Healthencia is a solution that tries to do exactly this. So in addressing the root cause, we are offering Healthencia as a certified software as a medical device that offers remote patient monitoring and digital therapeutics. And this is changing the daily life of chronic disease patients. It has 2 user endpoints. One is the mobile application for the patients that acts as a companion app for them. And the other one is a portal application for the healthcare providers that are viewing the data and manage the patients via it. What makes Healthencia different is the use of proprietary AI-driven behavioral change framework for a healthier lifestyle. And this is a mature tool that is out there and has some traction. It is today trusted by almost 50 hospitals. We have 4,500 patients that are engaged with the tool. These people stick with our tool for the duration they are supposed to use it. We have less than 1% dropout rate. We have been deploying our tool in 10 countries up to now, and it is generating some revenue for us. So all this is to demonstrate that this tool is mature. But what does it do? Let's see the 2 ends of this tool, starting with the companion app, which is actually customizable for different therapeutic areas and clinical pathways. This tool does 2 things. It collects data from the patients, offering this data to the healthcare professionals, but also offers back information to the patients information that is accepted by their doctors in order to improve their condition, or at least to dampen the speed at which their condition actually worsens. So on the one hand side, we measure things. What do we measure? We use devices and self-reports. And we collect information about physical activity, about sleep, and about different attributes like the heart, blood oxygen, blood glucose. All this happens via widgets that we have in our application, and these widgets offer a summary at the main screen. You can see the main screen at the center of the slide. This is our home screen, and it comprises the different widgets. And all these widgets actually have some summary for our patients, giving some data, and they offer details once clicked, and offer information about what has been happening there. So how are these measurements done? By devices on the one hand side. These devices are integrated with our system. There are devices that are integrated and constantly stream data into Healthenzia, like activity trackers that actually track the physical activity and the sleep and the heart rate of people. But there are also devices that are integrated on demand, like digital scales, like blood oxygen or blood pressure or blood glucose devices. When it's not possible to have all these integrated devices because simply the patient doesn't have access to them, then they can also self-report data via the widgets. This is especially interesting when they input their weight or other such data into the system. We also ask for more data from our patients. We use validated and informal questionnaires. In these questionnaires, we can capture any domain of our patients that we are interested in. For example, physical activity, the way they cope with their disease, nutrition, etc. And from those questionnaires, we can also calculate scores, either validated scores from the validated questionnaires or custom scores that we might be interested in. The second thing that the application does is inform our patients. So we give back information. This touches upon another very important domain in managing their diseases, the education. So we use notifications, we use analytics like the ones you have seen, I have already shown you in the different widgets, but we also use lessons that can be given to our patients, and dialogues that are pushed to them whenever the system decides that there is something of importance to communicate to the patient because the patient is lagging behind in their behavior in some domain. Of course, all these are proposed by artificial intelligence and can be accepted by the doctors monitoring the patient before they arrive at the patient. And you can see this as well here, like the way questionnaires are answered on the left-hand side, or the way dialogues are conducted or information is given to the patients in the middle next to the home screen. Moving along now to the clinical dashboard that is there for clinicians. This allows them to monitor the entire patient participation in a study or in therapeutic program. We can start with all the studies that a particular healthcare organization is committed in, And then we can monitor the registration process and the demographics of the population participating in a particular therapeutic program. And then we can deep dive into the data the patient give us, either with overviews from all the patients or going down into seeing many details on how they are doing across time. And finally, we can also supervise the content they are receiving, the content that we as doctors approve, or the content that, or how our patients actually have reacted to the content they have been receiving. Healthenzia is used today in COMFORTage, and it is used to support individuals at risk with cognitive decline and frailty throughout through cognitive and motor kinetic stimulations. So picking it up from what you heard before, we can actually access large populations by giving them access to Healthenzia, and we can screen them and monitor them, monitor their progress and their daily life in order to understand what is happening and understand any early signs and risky behaviors. Once we understand such things, then we can provide personalized recommendations that stem from a smart digital twin using what-if health trajectory scenarios. Also, Healthenzia is not working standalone, as Luke indicated in COMFORTage. It is tightly integrated with other platforms that are important in providing the care level we aim at COMFORTage. So it acts as a gateway to these other platforms. We have recognized the importance of serious games for assessing the early onset of dementia, and so we are using the Eligence platform for integrating with serious games. And we have also recognized the importance of training material. So we have tutorials and educational content stemming from the training educational toolkit of COMFORTage. It's not only important to play some serious games in order to train our brains and understand any decline across time, but we are gamifying the experience of the people that are using the mobile application in order to enhance the engagement level and achieve good adherence scores with the data collection. So we achieve that high adherence by making the application easy to use, fun to use, and important to use. So we not only give back to the patients information, but we also do that in a gamified way in order to have them stick around. We then evaluate the impact of using this technology and all the interventions we have been designing in slowing the decline of our users. And finally, we assess how the collected data improves decision support for changes that can occur in the care plans in the future.
Sorry, Aristodemos.
Yes.
Just a couple of minutes more. Thanks.
In gamifying the experience, we have the library widget that touches upon the behavior domain of ownership and possession, scarcity, and impatient. So there we have recommended material from the toolkit and the gateway to serious games via Eligence. We also have streaks of activity and a points system that touch upon the development and accomplishment, loss and avoidance domains. There we have gaining streaks for daily engagement and point rewards for accomplishments, shaping the leaderboard. The leaderboard itself touches upon the social influence and the relatedness. And we have this internal ranking leaderboard showing anonymized participants per pilot and where each patient stands among their peers. In terms of integration, Healthenzia acts as a gateway, enabling integration with this third-party platform. It effectively streams data from the connected platforms into Healthenzia widgets. The game widgets is populated with session data from Eligence. That's when you have played, what you have played, in which level, and achieving what score. And all this is very important for us understanding what is happening. The library widget also receives the personalized content from the training educational toolkit. And finally, we have streams of data from the Healthenzia widgets into the virtual health platform of COMFORTage. And that's all from my side. Thank you very much.
So my name is Marco Pirini. I'm the R&D director of Chimea. Chimea is an Italian company that was actually funded in 1998, so quite many years ago. We have located in Padua in Italy. We have several other operative branches. We still are an SME, so we are not a big company. We are just an SME, and we are manufacturer of medical device. So. From the very beginning, we started by trying to create breakthrough technologies for rehabilitation and telerehabilitation. And from telerehabilitation, now we are moving also to telemedicine and teleprevention, based on the concept of virtual reality at the very beginning. But obviously, to make things working and also simpler, we are producing also, and we are doing also our devices includes and take advantage of the concept of augmented feedback, biofeedback, and exergaming. Also, in addition to virtual reality, we actually the company actually was born as a spin-off from research at MIT by the Institute Professor Emilio Bizzi, which is still the chairman of Chimea's scientific committee. And our solution now try to cover as many fields of application as possible in the areas of rehabilitation of neurological, orthopedic, cardiorespiratory, and oncological functional rehabilitation. How do we collaborate with clinical center? We try to collaborate and to create win-win situations to get funded and to create new solutions usable and that can get beneficial for the patients by participating and co-working on national and international research projects. This is a way we pursue to continue collaborating with the clinical hospital, clinical research hospital, university, to continue adding value to our solution and to create the opportunities for such actors also to start using our technology and to include our technologies in their clinical practice and research activities. Right now, actually, we started from we have a very strong collaboration with I would say all the most relevant universities and research clinical organizations in Italy. In Italy, there is this kind of hospital funded to do research that are called IRCCS. And they get funded by the government to do research. And we co-work with all of them in all the possible ways for European projects, national and ministerial projects, regional funded projects, and so on. And we are moving also abroad, and we are trying to replicate this model of collaboration and co-working and co-designing also the solutions with also the same kind of actors around Europe and also in the world. We started marketing our devices and our solution also abroad, starting from 2020. And This is actually a very, very broad picture of what we do. We produce, manufacture, and develop both the hardware and the software of a vast array of devices to be used in both the clinical setting, the hospital setting, the rehab gym setting, and the home environment for with the telerehabilitation, with a branch of activities devoted to telerehabilitation. We will come back to this into a few minutes. So right now, all of these machines actually are connectable, can work by standalone, but are also connectable to a wide set of web-based, cloud-based services and interfaces for the clinicians to control the whole workflow of operation, and this workflow obviously is necessary if we want to create a real-world telerehabilitation set of services and solution that can work in the real world with patients at home. All of the management of data, all of these machines are medical devices in class 1. We have some patents, obviously, covering this, and the cloud solution with the management of the data coming from this machine and about the patient is obviously completely GDPR compliant. Yes, obviously, our devices are multi-language, and our solution are multi-language, and we are working a lot to make them multi-language in a reliable and effective way. This array of solutions from the hospital to the home environment allows our partners, clinical partners, to create a follow-up patient pathway for the patient from hospitalization to home. Consider that currently we have more than 200 installations in Italy and abroad of our technologies, and right now we have more than 1,500 home rehab devices working with our partners that have created the telerehabilitation services with them. So just let go a bit more into details. As said, all of our solutions are all of our devices you have seen in the previous slides are modular devices. What does it mean? That there is a central device, and depending on the software packages and depending on the additional hardware, wearable sensors, balances, virtual reality headset, cardiorespiratory devices, monitoring cardiorespiratory devices, you can have these devices working on different areas of neurological rehabilitation, and we are talking about neurologic, orthopedic, cardiorespiratory, and functional oncologic rehabilitation, and also can be work also on telemedicine areas and telemonitoring areas as well. A thing that I haven't mentioned before is that among our partners, we are partners of the several networks of research centers in Italy, the RIN, neurological network rehabilitation of the IRCCS, of the IDEA, the pediatric rehabilitation network of IRCCS, with which we started in 2017 to validate the usage of telerehabilitation in a number of conditions, neurological condition, or Parkinson's disease, multiple sclerosis, post-stroke patient, and also patients suffering from cognitive decline, so mild cognitive impairment and dementia as well. And we have some publication of that. I will be very quick here. As I said, each machine can be configurable with many different rehabilitation modules. Right now, we have more than 20 different modules with exercises and evaluation operating with the sensors, without the sensors, for cognitive, speech therapy, neuromotor skill, cardiorespiratory areas, and so on. Postural activities with rehabilitation and prevention of fall, and so on. There is no time to go deeper into all these modules, so just few more bullet point information. Right now, a single system can host up to 1,000 different exercises. All the exercises comes from a co-design process with clinician and with research partners we had in the last 20 years, actually. And Here you see the VRS. That is a big machine to be used in clinical centers. This is for an example of a different form factor, the compact, that is being used by neuropsychologists and by speech therapists in their rehab spaces. And it is the compact, but the very same, we have the very same software and the very same modules. Obviously, we propose different modules in different application areas. As I said, we have more than 1,000 exercises, and the important thing we learned is that each exercise needs to be adaptable to the single patient. So each exercise is very changeable by options and by the level of difficulty, in order for the therapist and in order for the clinical partners to adapt the exercise to the specific need for the specific activities and the specific needs of the patient. So the systems, together with the cloud, so together with the web interfaces, are provided with an automatic reporting system. So each activity is being tracked by the system, and they populate the clinical report of the patient, where we can know if the patient has done the exercises, has done how was the performance of the patient during the exercise, and so on. Right now, together with our clinical partners, our technologies and solutions have been the subject of around 100 clinical publications and around 40 reviews in a wide range, for a wide range of conditions, including mild cognitive impairment, MCIs, and Alzheimer's disease. Let's focus a bit on cognitive rehabilitation activities. We have right now in cognitive and speech therapies activities, let's say, more or less 200 exercises right now. The cognitive activities can be performed by the patient via the touchscreen, via a touchscreen pen, or via wearable sensor, or via balances, if they are available in the configuration, in order to combine cognitive tasks with postural and motor tasks. This is very important for rehabilitation, but also for cognitive decline prevention. And we have all of each activity. We have a set of exercises and activity for practical skills, visuospatial processing, attention, temporal orientation, short and long-term memory, and for executive function. All of them host auto-adaptive mechanism to adapt to the patient, and a wide set of options in order to be able to adapt them to the patient ability, to the patient residual, to the patient current state, actually. The module obviously is being used widely by all of our clinical partners, all of the installations we have talked before. And right now we are working to enlarge further this set of activities. In particular, we have two projects, one with the Professor Annalena Venneri from the University of Parma, from the IRCCS ESNB of Bologna, to build up, to port on our system a cognitive program, stimulation program that already has been proved to change the connectomics of the brain of patients in mild cognitive impairments and to delay cognitive decline. And we're working a lot with the Hospital San Camillo in Venice, that is an IRCCS as well, to port on our infrastructure a FineAge, a program that is called FineAge, is a set of 80 and more cognitive activities devoted and studied to train the subject to to be kept stimulated on day-by-day management of financial abilities and money management abilities, and day-by-day also executive functions. On top of this, we are working on these two, with specifically these two institutes, also to build up on our web-based solution. I will show you in a second. Also a wide set of remote evaluation tools to allow clinicians to evaluate the subjects on a more frequent basis while they are at home, and not calling them to come at the hospitals and do the evaluation activities there.
Sorry, Marco, just a couple of minutes.
Yes.
Thanks. Thank you.
We have a lot of activities also in the speech therapy domain. And so the previous presentation by Professor Sergi Valero has been very, very interesting. And we would like to continue the discussion maybe in the future and to see if there is room for collaborations. And also we have also for cognitive, in the cognitive area, fully immersive VR scenarios for ADL that are being currently used also for cognitive decline treatment and for Alzheimer's disease. Few words about telerehabilitation. As I said, we started working since the very beginning on telerehabilitation solutions. Right now, the telerehabilitation solutions we proposed and that are currently very, very widely adopted also by entire ASL. In Italy, we have these local health authorities, public health authorities that have started in the last 3 years to build entire telerehabilitation programs and services in the population on the territory with our solution. And the most relevant are the ASL Roma and the ASL Ferrara that are currently using a lot our system with their patients. For the telerehabilitation, we have this case with a tablet that can host a wide or not, it's a modular device, a wide set of additional sensors, including postural devices, telemedicine devices, and wearable sensors or not. We have a wide set of cognitive rehabilitation and prevention programs just using the tablet and the camera. And the therapists can work with the patient in 2 ways. Online, so we have a web-based audio-video conference and remote control service, and offline, so that the clinical partners and professionals can program the set of activities, the personalized treatment plan on the website, and the patient and the tablet discharge this once it gets connected to the internet, and the patient can work autonomously to it. So it's a very flexible solution, allowing both a full mode, full synchronous way, of working between the therapist and the patient, but also offline working with the patient left alone or with the caregiver to do some of the job or some of the treatment alone. We are now working also we have also an app for replicating in a simpler way all of these aspects and telerehabilitation ways of working between the clinical therapist and the patient. And that's it. Thank you so much. And we are